Good afternoon. My name is Elizabeth Bankole, and the module title is Communication and Interpersonal Skills. And my presentation title is Analysis, the Strength and Limitation of Assertive Communication within the Health and Social Care Sectors. This presentation actually examined the concept and application of assertive communication within the health and social care practice. What is actually assertive communication? Assertive communication is a process whereby a capacity to express concerns respectfully and confidently regarding issues that may compromise patient safety, while also articulating professional opinions to colleagues, including those in positions of authority. Also, the primary aim of assertive communication critically evaluate, appraise, and synthesize quantitative evidence on the effectiveness of assertive communication among healthcare professionals, with particular attention to its impact on service user safety and behavioral outcome. And also, in terms of an assertiveness, your colleagues might look at it as if you're being aggressive. There is a difference between being assertive and being aggressive. So we cannot combine those two together. It doesn't interwoven at all. Therefore, assertive communication is examined as a flexible skill that can be adapted to individual needs and situational context. Effective practice also relies on communication competence, defined as the ability to apply appropriate communication strategies and adapt them to specific interpersonal and professional contexts. Definition and characteristics of assertive communication. I'm going to explain the stars and its key trait. Assertive communication can be conceptualized as a core interpersonal competence to enable individuals to express their thoughts, feelings, and needs in a confident, direct, and respectful manner, while acknowledging the perspective and right of others. The styles of assertive communication critically articulate personal needs and viewpoint in a respectful and constructive manner. As an healthcare professional, you need to demonstrate respect for others, opinions, values, and boundaries, and you should be able to balance personal interests within the needs and expectations of others. And as an healthcare worker, you need to be able to promote compromise and collaborate problem solving. And the characteristics of assertive communication can be, as an healthcare worker, you need to have that confidence in expressing your thoughts, emotions, preferences without any hesitation, and also to be able to use your initiative and sustain healthy and respectful relationship. Awareness and protection of personal rights while acknowledging others' rights is really important as a characteristic of assertive communication. Maintenance of your self-esteem while interacting with others as diverse contexts is also a very, very important characteristic of assertive communication. What are the strengths of assertive communication and why is it effective in health and social care? Assertive communication represents a critical strength within the health and social care practice as it facilitates clear, respectful and purposeful interaction in complex and often high-pressure environment. It also enables healthcare practitioners to convey information, concerns, and professional judgment confidently, thereby promoting patient safety and reduce the likelihood of misunderstanding of information errors. This approach is particularly effective in situations involving conflict or uncertainty, as it supports constructive dialogue and the achievement of mutually acceptable outcomes without resorting to aggression or withdrawal. Just like what I say, so many people actually combine both assertiveness and aggressive, and that is not really interconnected at all, because being aggressive is actually different of being assertive. Therefore, in a multidisciplinary setting, assertiveness actually enhance collaboration by ensuring that individuals can contribute their expertise while valuing the perspective of others. Healthcare professionals frequently perform diverse roles, including clinicians, educator, and coordinator, and assertive skills allow them to balance this responsibility effectively. Furthermore, the development of assertiveness supports both personal and professional growth, strengthening confidence when engaging with patients, families, and colleagues across various sectors. Overall, assertive communication fosters empathy, promotes respect, and underpins effective partnership working within the health and social care. Limitations. There's no way that we will have the strength and we are not going to have the limitation. Briefly, I am going to let you know just a few of the limitations, and the rest can be found on my slide, my PowerPoint. Assertiveness is sometimes misconstrued as disconscious or inappropriate behavior, just like what I've been saying. People might look at your assertiveness as being aggressiveness. Concerns regarding potential negative repercussion may inhibit assertive repercussion. Organizational hierarchies and imbalance in authority can restrict open communication. For example, in the healthcare sector, the doctors might see themselves to be more hierarchy than the nurses. And if there's any issues at all, the nurses will be able not to be able to be, to have that open dialogue or open communication in that setting, because they feel that, oh, it is the medical doctor, they are going to be more higher than them. And also cultural expectation. Limitation of trainings and competence in assertive skills may hinder effective practice. Absence of adequate guidance, mentorship, and positive role models may impede skills development. How do we apply assertiveness in practice? In my slide, I actually give an hypothetical organization context of an example. But while I'm talking, I'm going to give you a brief example of when I, Elizabeth, actually been assertive with one of my colleagues. And this is just about the colleagues that keep on repeating submitted report late, and which is affecting the branch operations. Therefore, I decided to raise a concern through my emails, and I'm ensure that my email is very, very assertive. And I have to address the recent delays in the submission of the weekly report over the past few weeks that my colleague has been sending a report late, and also I need to let my colleague agreed on a deadline which has impacted on our ability to finalize our branch update on time. So moving forward, what I actually did is that I actually let my colleagues know that you need to submit your report at this time and the day. I'm being specific, and has agreed to ensure that we maintain operational efficiency, because if there are any challenges preventing this, the colleagues should let me know so that we can actually address this in advance. So this is my own professional example of being assertive. But in my email, in my slide, I actually put the hierarchical organizational context example. How can we improve assertive communication limitations? There are several ways to improve and overcome the assertive communication in health and social care sector. Number one, we need to have a good training to enhance our confidence, psychological well-being, and work engagement among healthcare professionals. And we need to be able to strengthen ability to express views clearly while respecting others, promoting professional self-efficacy, improve self-esteem, and support confidence within the multidisciplinary team, encourage patient advocacy, shared decision making, and improve safety through clear communication. Having assertive behavior is reinforced by knowledge, confidence, and professional accountability. Enabling proactive participation in care delivery and team-based decision process. Reflection In conclusion, my reflection has reinforced my understanding of assertive communication as a balanced style that promotes clarity, respect, and professional integrity within the health and social care, and by honesty, confidence, and active listening. This enables me to express needs and concerns while value the perspective of others. I also recognized its strength in supporting collaborative decision making, safeguarding service users, and reducing misunderstanding. However, I'm also mindful of potential limitation, such as being perceived as confrontational, if not deliver sensitively, or when cultural and emotional context have been overlooked. I will continue developing self-awareness, emotional intelligence, and reflective practice, seeking feedback where appropriate. Overall, I have learned that effective assertiveness is not fixed but adaptive. But refining this skill, I aim to build trusting relationship, enhance teamwork, and contribute to safe and service users person-centered care. In terms of my adaptation, I will tailor my assertive communication to individual. And firstly, the implementation of person-centered care has been associated with enhanced continuity of care, of health and social care, and improve responsiveness of service and more effective utilization of healthcare resources. It also reinforces the role of frontline practitioners in delivering tailored interventions that align with patient needs and expectations. Interprofessional collaboration is equally fundamental in supporting high-quality healthcare delivery. It involves professionals from diverse disciplines working collaboratively with patient families and caregivers to provide comprehensive and coordinated care. Assertive communication plays a central role in facilitating both person-centered care and interprofessional collaboration. It also enables healthcare professionals for a good team work, because if there's no teamwork among the multidisciplinary, there is going to be a clash in terms of giving the service users an holistic care approach. So being assertive in all multidisciplinary team does not mean that they're being aggressive, but they, as an assertive healthcare professional, you need to differentiate being passive and being aggressive and being assertive. Thank you.